Hello and happy Friday. There's a new drug on the market, and I'm not going to sing the little jingle for you, called Ozempic. And Ozempic is what's called a GLP-1 agonist. And what it does is it works as an appetite suppressant, and it works within our metabolism to mobilize different stores of glucose in our body. And in the end, what it does is it causes us to lose weight. But what we're actually seeing it happen is that it actually preferentially seems to lose quite a bit of weight in the face as well. Now, we know based on some other things that tends to make people look more aged. There was a catchy little thing that came up a couple of years ago called runner's face, where people have talked about the same kind of phenomena, where if we lose so much of our body stores that our face looks drawn or emaciated and just doesn't look as healthy as your body is actually doing. And the same thing can be said about Ozempic. It's a great drug for our body's health, but our face may actually look kind of older for it. And the same would be true, for example, for running. Well, what do we have to do, or what can we do to help that? So there actually are different solutions that we have in an office like this. And if you lose fat, for example, there's this old adage that you can, yeah, I know, don't you love the model? Is that you can do what the old adage in our field is, replace like with like. And the concept is, if we've lost fat, why don't we replace it with fat? So we can harvest fat from the abdomen or belly, or maybe the flanks, because that's where the transfer rates are the highest, the survival rates are highest. And we can replace those in areas where we typically lose them with things like Ozempic, which tends to be in the high cheek or in the submalar area down in here. So we can very easily replace that with a clinic procedure. We can also use the old standbys, which are things like hyaluronic acid products. Those are based on the Juvederm family of lines or the Galderma family of lines, the Restylane family group. And you can do, and there are other ones out in the market, for example, but you can use those also as HA products to help restore the same area. And those will last anywhere from between a year and 2 years. Those are also great solutions. And there are also stimulatory products like Sculptra, which are also something that slowly dissolves under the surface of the skin once placed. And they can also have up to a 2-year restoration of volume. Same story, same area, very nice, seamless, very safe, very straightforward procedures. So we do have solutions that we can use for that. So what should we do about this? Well, Ozempic is a great product. We really shouldn't be saying don't use that. Again, work with your doctors if that's something that's been suggested for you. And the same is true about weight loss in general. The same is true about running, for example, getting in shape and doing something like runner's face. We know that loss of volume in a face is inherently aging, but there really are some very reasonable solutions out there.